Hi, my name is Hassan. I'm a level 1 nursing student. Is it okay if I follow you today?
Of course.
Uh, could I get the SPA on the patient, please?
Yeah, you can. The patient we're following today is Shanana O'Connor. She's a 34-year-old female who is a full code. She's on universal precautions. She's allergic to trimethoprim. The patient was admitted from the emergency department with a fever, with chills, sweating, just an overall feeling of some aching. The patient had a pain of 4 out of 10, described as like generalized aching all over. The patient is also on end-stage renal failure. The patient does receive dialysis. The patient has full range of motion. There's some mild weakness in the lower extremities. The fever is still yet to be determined. The white blood cell count is elevated at a 15 right now, but we're still waiting back on the rest of the blood sampling. The patient's cooperative. As mentioned previously, there's some generalized aching. Patient has good elasticity. Both radial pulses are 2+, but the pedal pulses are a 1+. The capillary refill is less than 3 seconds on both the left and right hands, but it's above the 3 seconds on both of the lower extremities. The patient has active bowel sounds in all 4 quadrants. The abdomen is soft. The patient's urinary output is at 200 milliliters. The patient does have trouble urinating. It's difficult to void. The urine is amber. It's cloudy. The patient did receive an X-ray, chest X-ray, and it appeared clear. The patient can ambulate by herself. The patient does receive 0.1 milligrams of clonidine 2 times daily. The patient is also going to be receiving an antibiotic to treat this unknown infection that we're currently dealing with, imifentanil, 500 milligrams Q every 8 hours, and we're going to give the patient normal saline, 0.9%, 30 milliliters per hour. The patient's vital signs are 20 respirations, a fever of 101.9, heart rate's 95, blood pressure is 138/78, and oxygenation's at a 96. The patient also has some non-pitting lower edema in both the lower extremities, but the main concern right now is the unknown fever. So,
Okay, thank you. Why specifically is the client receiving this medication?
well, the patient has an infection, and they're exhibiting signs of this infection as well.
What action does the medication have on the body?
It inhibits bacterial cell wall synthesis.
When should you question administering this medication?
If the patient has a history of being allergic to like any types of penicillins or is allergic to this specific medication.
Does the medication have a therapeutic serum level?
It does not, no.
Which vital signs must be monitored?
All of them, temperature, heart rate, blood pressure, oxygenation, and respirations.
Which physiological parameters should be monitored when the medication is being administered?
We're going to look at the patient's lab work. We're going to look at the creatinine levels, the BUN levels, as well as the ALT and the AST levels.
What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
To always continue the antibiotic regimen completely, to not stop it ahead of time, just to continue the full dose that's prescribed, and also to keep an eye out for any symptoms of like a rash or wheezing, or where the administration is being put in, just to keep an eye out for any swelling, and to always notify the healthcare provider if something like that's occurring. But to really just keep an eye out for like painful swelling or an allergic reaction of some type.
What intervention must be taught for taking the medication safely at home?
The same thing, keep an eye out for allergic reactions, any types of rash or wheezing, in particular vomiting, nausea, and to always continue the regimen completely without stopping.
What are the side effects and potential adverse reactions?
Vomiting, diarrhea, swelling around like the face and tongue. You can have rash, wheezing, elevated heart rate. You can have like foul smelling stools as well, bloody stools. These are things to keep an eye out for.
How will you know the medication is effective?
We're going to check the patient's lab work. We're going to check their white blood cell count to see if the infection is being fought off. We're also going to just check for visible signs of infection if the patient's comfortable, any types of aching, fever, chills, anything like that that's occurring with the patient we'll observe.
Thank you.
Yeah, not a problem. All right, so I'm going to go into my patient's medical record here. I have my patient at another age. I'm going to go ahead and take a look here to see if they have any allergies. They do trimethoprim, sulfamethoxazolone. I have the right patient, so I'm going to go here and check on my MAR. Okay. I'm going to be giving sodium chloride 0.9% normal saline, 30 milliliters an hour continuously. I'm also going to be giving imipenem, cilastatin injection. I'm going to give that IV piggyback every 8 hours. That's an antibiotic. So I'm going to go ahead and look here. So I have my right patient. I have the right medication, the time I'm supposed to start, the amount, and the route is going to be IV. So I'm always going to check these things here. So I can go ahead and pull out my medications. I'm always going to look at the medication itself. I'm going to try to match it up with the MAR, check the expiration date on both bags, see if there's any like cloudiness or anything unusual happening in the bag, and make sure there's no puncture wounds. I'm going to do that for both medications. Also, if I have any questions about these meds, I can always contact the pharmacist or physician. If something doesn't add up, or if I don't know how to administer the meds, or I have questions about the procedure, I can check a drug book or contact the pharmacist. So I'm going to look at my meds again. I'm always going to check my patient rights. Everything matches up. Both of these are, the date is not expired. So at this point, I can wash my hands, come to my patient's room. Hi, how are you? I'm Matt. I'm going to be your nurse today. Could you just go ahead and tell me your name and your date of birth?
Shanana O'Connor, and I am 34 years old.
Great. Do you have any allergies?
I do. Trimethoprim and sulfamethoxazole.
Awesome. I'm just going to take a look at your wristband here. Perfect. Okay, so you do have a fever right now, and I know you're feeling a little bit of discomfort, a little bit of aching, cramping, just raising up your bed here. Your white blood cell count is a little bit elevated. We're still waiting back on some of your blood work. So we're going to go ahead and get you started on just a normal saline, and we're going to put you on an antibiotic because we want to try to get this infection under control. And as soon as we get your blood work back, I'll let you know what's going on with it, okay? So I'm always going to check the patient's MAR again, just to verify that what the patient's allergies are, if they match up with what's told me, to make sure that I have the right patients. Okay. So before I flush the IV, I'm just going to type in the patient's ID here. We're going to get this information put in here. Okay. I'm also going to put in my medication. And I am going to flush the IV, but I'm going to do it before getting this set up.
No, I did once she was. I thought after you left. And then I was like,
Okay, so I got a green light here. So I'm going to go ahead. I'm going to flush patient's IV. I'm just going to check for any signs of like infiltration. Just make sure that it's flowing through here. Make sure this is unclamped. put this in the sharps container. Undo my gloves here, throw these out. So I'm checking my medication. Everything does match up here. Everything matches up with the bar. I have the right patient, the right medication, the time I'm going to be giving it, the amount. Okay. I'm going to be using a dial flow since I don't have an Alaris pump. So I'm going to go ahead and check my tubing. Make sure that this is cleaned off. I'm going to spike my bag. Hang it. I'm just going to prime the tubing, make sure we get all the air bubbles out. So we got all the air out here. I'm going to hook up my dial flow. I'm doing 30 milliliters an hour. And I'm going to go ahead and hook this up. So what I can do with the dial flow, this patient's supposed to be getting 30 mLs per hour, so I can set that to 30 mLs per hour. And I'm always going to check, there's like a rule of 5, just to check for 5 drops basically. Okay, so this is flowing well. So the site, it's going to be the right radial. I'm going to type in the time that this medication was given. I have a 1,000 ml bag, and I'm doing 30 mLs per hour. I'm always going to initial it. Okay? And all my medications are going to have stickers as well, so I'm going to go ahead and just stick this somewhere in the tubing. Okay. Now looking at the next medication. I'm going to type in the information. my medications match up. I do have my right patient, I have my right route, my right medication, time, and dosage as well. So all these things match up with both meds and this as well. So here I'm going to be hanging with piggyback. Make sure everything is already clamped. Okay. Hang this up here. I'm going to put my primary bag a little bit lower. Okay. I can clean off this. An alcohol swab. What I can do is I can hook it up and then I can prime the tubing. By bringing this down a little bit lower and then releasing it. That way I don't lose any of the medication. Okay. So now that I've got this hooked up, this I'm supposed to be giving at 100 mLs per hour. So I can go here to my dial flow. And I can set it at 100 mLs per hour. This is going to infuse, and I'm going to come back and check this once it's done. Good, I've got both clamps open. I'm going to check with the patient just to make sure that they're not experiencing any discomfort. Okay. So now that I've got both these flowing, this is going to run and then it will kick into this. So I can wash my hands again. I can type in my administer time. Piggyback, there's 500 milligrams is going to be given. 100 milliliter bag, 100 milliliters per hour. I'm going to go ahead and initial this. Okay, so once that's done running, I'll come back and I'll change this. I'm going to change the dial flow back to 30 mLs per hour, because right now it's set at 100. But what the primary bag is only set at 30. So I can dispose of everything else. I'm going to check with the patient to make sure that there's no discomfort. I've already got my stickers here. Okay. So how are you feeling? Feeling okay? Any discomfort?
Yeah, I'm feeling okay.
Okay. So we started this antibiotic. I just wanted to go over just gonna lower your bed here. I just want to go over some of the signs that you should keep an eye out for, like rash, swelling, or like any irritation or nausea. Any like irritation around this injection site as well. You're just gonna want to notify somebody. So could you just go ahead and repeat just a few of those signs back to me, just so I know you understand?
You said I might to notify someone if I get a rash, irritation, nausea, side effects, stuff like that.
Yes, perfect. Okay, well, I'm going to let this run. I'll be back to change your flow rate and do this in the next hour, okay? So if you feel any discomfort, just let me know. I've got your call light here. So just go ahead and press that like whenever you need any assistance. And yeah, just let me know.
Okay.
Anything else you need. So I'm going to leave the patient's room. I'm going to wash my hands. And I can finish up any other charting in like a timely manner.
I have a few more questions to ask you. Were there any pertinent piece of information you reviewed before administering the client the medication?
Just the physician's orders and the lab work.
Did this information affect your decision to administer the medication?
Yeah, I mean, looking at the doctor's orders and then the patient's labs, what blood cell count would determine whether we go through with it.
Did this information affect how you administer the medication?
No.
Okay. Thank you.
All right, thanks.